An A in anatomy and physiology means you passed the class. It does not mean you understand the human body in the ways that OT practice requires. And that distinction matters to your application and clinical readiness far more than OT students realize. So, for the next few minutes, I want to show you what clinical understanding of the human body actually looks like and why programs evaluate it in ways that go way beyond the transcript. Occupational therapy is a science-driven profession. Anatomy, physiology, kinesiology, neuroscience, those are not just boxes to check. They are a foundation to every clinical decision you will make. But most pre-OT students approach the prerequisite coursework the same way they did undergrad courses. Learn the material well enough to perform the exam and move on. The problem is that OT practice does not ask you to recall information like a multiple choice exam. It asks you to apply information in real time to a real person whose situation does not match the textbook. And that application requires a different kind of understanding than just passing the class. And here is what the difference looks like in practice and how it shows up in your application in ways committees can identify immediately. You earned an A in anatomy. You can identify the structures of the shoulder on a diagram. But can you explain what a rotator cuff weakness does to a person's ability to perform their dressing? You know the neuroanatomy of a stroke, but can you explain what a right hemisphere damage does in practice? How does a patient process sensory information and safely perform daily activities? You understand cardiac physiology, but can you explain why a patient with congestive heart failure fatigues differently when bathing than someone without COPD? Those questions are the gap between memorized information and clinical understanding, and committees can tell which side of that gap the applicant is on. Here is where that gap shows up in your application and the specific evidence committees are looking for that most applicants never think to even provide. When I reviewed applications, I was reading observation descriptions for one thing above others, not what the applicant watched, whether they understood what they were watching. The applicant who described watching an OT work with a stroke patient demonstrates basic awareness and observation skills. But the application who described watching an OT modify a dressing task for a patient with right hemisphere neglect and articulated the connection between the neurological deficit and the clinical decision. That applicant demonstrated the very beginning of clinical reasoning. That difference is between a good observer and a future clinician. So here is what developing and demonstrating applied clinical understanding looks like, even if you've already accumulated your hours and you can't go back to get more. Go back through your observation notes with one question. What was the diagnosis and what were the functional implications for daily activities? For every experience, if it applies, connect what you saw to what you know. Neuroscience, kinesiology, physiology. Ask, was the OT making specific clinical decisions given what I know about this condition? Were those connections between observed practice and scientific knowledge? That's the beginning of professional reasoning. They make your observation descriptions and your statements read completely differently. Applied clinical understanding is professional reasoning. The ability to connect scientific knowledge to clinical observation is the very beginning of what clinical thinking starts to look like. It shows up in how you write about your hours and how you talk about the profession in your interview. It shows up in your ability to answer a scenario question by reasoning through it rather than just retrieving a memorized response. And it is the most consistent differentiator between applicants who demonstrate clinical readiness and those that demonstrate academic accomplishment. Those are not the same things, and committees know that. If you want more information on how to expand and refine your application for this cycle, you can join my OT community, OT Student Leveled Up, or if you want to engage with me directly, you can click and join some of our groups. We have a lot coming up in this new season, so I look forward to meeting you.